different ways. And oh, sorry. Um, and then there was an increased demand for equitable partnerships and greater inclusion of community members to help drive research agendas. And funders, quite frankly, as I'm sure all of you know, really started to make it more of a requirement for community members to be partners on research studies. And so it's very important to foster these relationships, build these connections, and help sustain these partnerships to advance health equity and reduce the disparities that we've seen for forever in our country. Sara? And so keep going. So we took the time months to really gather input from a lot of different stakeholders, community members across all segments in terms of area of focus, geographically, size, etc., as well as academics who either do community engaged work, have an interest in community engaged work, some who have not done community engaged work, just to gather their input around what reach should be. And so we conducted interviews with key informants initially. We held focus groups across those stakeholder groups. We administered surveys, and then we designed a website. We decided upon a website as the flagship sort of signature piece of reach. And we'll talk a little bit about the website in a bit. And then we did some user testing with the website for both academics and community folks. And the website is actually live now, which we're really excited about. And so keep going. Oh, you know what, Sara? One of the things I will highlight is this point that we want to ensure that the relationships are equitable and that community members don't feel preyed upon in any way or exploited in any way. Really digging into this understanding and recognition that there are clear power dynamics in these relationships, and hoping to be able to support academics and community members to think about how to shift and try to balance some of that power along the way. And so I just want to point that out. So we have created a code of conduct, and we hope that folks would really be able to adhere to. I will say that community members are very good at reporting back to us. They are very good at complaining about things that aren't going well, making their voices, their interests known. Which is why we really think the Community Scholars Program is essential to continue to build the knowledge, skills, confidence, and capacity of community members to serve as good partners in research with Penn academics. We also recognize the importance of our academics having that same sort of frame in terms of how to approach these partnerships. And we will also be offering a series of trainings and talks related to building that skill set even further for academics. Sara, keep going. Okay, so let's just keep going through. All right. So for reach, talking to people, we learned a lot of different things. So there's a lack of trust and not listening to community needs is a barrier to partnering. And so this whole Connect platform is really created to, one, make sure folks can find one another easily, but also to have the supports in the background to be able to foster the trust, build the relationships, and approach it in a proper manner. Sara, keep going. Keep going. Yeah, these are fancy slides. So they're all over the place. So sustainable funding support for both partners is necessary for success. Um, we really hope to be able to, through coaching and ongoing coalition building and the programming and training and all sorts of activities, mixers to bring folks together to build their capacity. Folks who have done research for a very long time oftentimes believe that they have it, but they have it. But what they often don't have is really how to work with community. And what we've heard from even some seasoned sort of researchers is that, oh, we're fine, we do a great job. We've had our partners for a long time. And unfortunately, we've heard from their own partners that there's a very different perspective on how things have been, how they're going, how resources are shared, how the power dynamic is clear and it still exists. And so there is some sort of level setting that is needed. And we hope to really support partnerships so that they are sustained over time, but also fundable partnerships across the board. Sara, I'm just trying to be mindful of time. And so here are some of the elements on the platform itself. And you can actually view it at, oh, I think Megan already put it in the chat, but reachpin.com is the site. And so there's a partner cohort program. We're happy that we'll be working with the Amethyst Project to really build a cohort around maternal health, a platform to connect with others, which I spoke mostly about. Folks can go on and create a profile, so we encourage you all to do that. In your profile, similar to like a LinkedIn, you can go on, create a profile, put whatever you like in there, your bio, photos, maybe events, links to your papers, videos or interviews, anything that you like to put to really highlight your work and areas of interest. And then folks are able to go in and search by keyword to identify others with a similar interest. And the good thing about this is you don't have to do the legwork. Once you say that you're interested in partnering with someone, we will help facilitate that connection. So there's community folks on the site. There's some academic folks on the site. We plan to really make this a robust site. We just started to build up the profiles, but we expect that folks would be interested. We'll be doing a campaign to really get people and drive them to the site, starting with our community partners tonight. And there's also resource sharing. So there's an online resource library. Funding and training opportunities will be listed. If you guys ever have anything that you want it to be listed that you think applies, please send that information our way. And then there's individual and partner coaching that would be available for dyads in a partnership or a full coalition, or if it's just an individual trying to frame an idea or an approach. We do this throughout the week already. So, and we've been doing it for years. And then it's the Penn Community Scholars Program. I encourage you guys that if you have community partners that you currently work with or want to work with, this is a nice way to help build their capacity. They really leave the program feeling much more confident and equipped to partner in research. So our next cohort won't begin until next fall, but we'll be sure that we send out that notification for you all to distribute to your own partners. And is that it, Sara? Okay, we're in phase 2 now. So we've designed the platform. We're using a re-aim framework under the implementation science framework, which is reach, effectiveness, adoption, implementation, and maintenance / sustainability. And I think that will be all we really want to cover today. Thank you so much for your time. And reachpin.com is where you can find that platform.
Thank you so much, Nikki and Sarah. This was really, really fascinating to hear about these projects. And it's also got maybe my mind and everybody else's mind sort of spinning around different questions to ask. If any of you have questions for Sarah or Nikki, please feel free to put them in the chat or raise your hand or come off mute and talk. I'll get us going with like one question that's kind of been on my mind, Nikki, ever since you were just talking about the code of conduct between the participant, you know, the CSP program participants, their pitch, and then the people who would partner with them. Just curious, because I think I really worry about how trust can get eroded in those partnerships if one or the other partners is not living up to that code of conduct. And it sounds almost like you all have been like relationship counselors maybe between those two groups. What's that like to navigate? And do you have any like tips you could share with us when maybe some of those similar things pop up in our own research world where
Yeah. So one of the things that I will just emphasize again is that I think it's critically important to do all of this sort of framing up front. Have those tough conversations up front. Think about, and you don't think about this so much from an implementation standpoint, but there really is a method to this that I think folks have to consider. So, which is why I say how you start matters. Really having that lens of learning, getting some insights, figuring out how to align interests and agendas, setting up guiding principles for the partnership that you mutually agree upon. Um, Thinking through things such as dissemination, such as if there's going to be payments, resource sharing, information sharing, thinking about roles and responsibilities. And I say not just thinking and talking about it, document it by way of a partnership agreement. And then when those conflicts come up, and I assure you, just about every partnership has one, you will have something to reference. I So that's for you guys. For us, I don't know. It just seems like a natural thing for us at this point to be able to, navigate those conversations. And I think it's partly because of the confidence that we have in knowing that it can work, right? These partnerships can work and they are very, very important. And so it's the same thing as if you would save any relationship, right? You go all in and they are critically important. We are much better together. One of the I was a part of the Philadelphia Collaborative Violence Prevention Center, which was led by Joel Fine at CHOP, I think back in like 2006. And we almost like blew up the center from the beginning. I worked with Dr. Jerry Johnson, who had worked with community groups to form a coalition of about 21 community organizations, and working with a group of academics across 4 institutions in and of itself is another thing, right? But coming together and not like having these sort of all the things I just talked about ironed out in the beginning. Along the way, like the coalition, the community coalition said, we're out. Like, we don't want to do it. We don't want to work with them. We don't feel respected. We don't feel heard, et cetera, et cetera. And what Joel was really good at doing was, wait a minute, how about this? Let's back up, figure it all out, which we did, and let's just make an agreement now that no matter what happens, no matter what we disagree upon, we agree to stay at the table. And so everyone did that. And we had many more disagreements, but everyone had that fundamental sort of understand, as you would like in a marriage, right? We stay and we work it out. And so that's what happened. And that's what really helped to reset like everything for that particular center, which was extended probably another full cycle and then beyond that. So I see that as like one fundamental principle, but you got to build trust with people to be able to even get to that kind of point.
Yeah. And I'll just like reiterate the having something up front, because you would ask what it's like for us, and where my mind went was like different when what Nikki said, where it's natural. I went to like what it's like in real time is usually people frantically coming to us or calling us really pissed off. So that's what it's usually like. And that they have that trust to come to us, that we're able to work with them. But oftentimes they do say, I'm done, this is my last time with Penn, because we're all Penn. Like, whether or not I'm Sara, she's Nikki, you're Amanda, like, we're Penn, and that's how they see it. So yeah, as much as you can up front, sort of address those things.
Yeah, it sounds like having neutral parties like you all also involved is helpful, right? Having another person to say, wait, we need to step back is really helpful. Is it Eunice? Please go ahead with your question.
Hello, everyone, and happiness to you all. My name is Giannis Sidnor, better known as Happiness. So if you see me out and about, I go by Happiness because I have a lot of joy to spread. Nicole, team who made this presentation, I am doing this for you. Amazing. I, along with Reese on this call, have the privilege of working with Junko on a study, and we are out and about in the community. I'm born and raised in Philadelphia, privileged to be a Philadelphian, but I have had the privilege of traveling around the world. Transparency, what I hear from you, trust what I hear from you, and to not give up, and to understand that we're all human. And that's what we have the privilege of doing. And as you said, no matter what, we're Penn. We are Penn. And none of us take that privilege lightly. And to be out and about in the community is amazing. So I am privileged to say happiness to each and every one of you today, and to let you know that I receive the information that you have shared with gratitude and fuel to continue what we are doing to understand atopic dermatitis in our communities. So thank you again.
Thank you. Thanks for that comment. I will just say, from my own personal and professional perspective, I wear two hats. So I have been a member of the Penn community since 2004, but I grew up in Southwest Philadelphia, live in West Philadelphia. I come from a family of activists who oftentimes rallied against the institution that I'm now a part of, but also partnered with the institution. My grandmother worked with two presidents very closely around a lot of different issues that impacted the community, and really made progress along the way, which is where all of this comes from for me. And so it's a tricky thing. I remember going out into a community site with some researchers, and it was actually the recreation center where I went to as a kid, and knew everyone there, and they said hi, but they were like, why are you here with them? And barely wanted me to be around at that point. I came back later for the Little League. It was actually a football game. Everybody's like, Nikki, so it really, like, those hats. And it's a really precarious position to be in, which is why you have to be confident in the work that you're doing, to be able to navigate those two worlds.
Yeah, thanks so much for that comment. Megan, did you have a question?
Yeah, first I just want to say how grateful we are that that Nikki, you and Sara are sharing all of this information with us, and have created this group of folks to learn about what you're doing. And I also want to say hello to our community partner for Amethyst, our maternal health implementation science hub, Miss Grandison, who's on the call. But Nikki, I was particularly interested in what you said about this disconnect. Hi, Miss Deborah. In the disconnect between what some researchers think, how they think their community partnerships are going, and how their community partners think their partnerships are going. Can you say a little bit more about how we determine whether these partnerships are healthy and robust and meaningful and genuine? How do we, on either side of those partnerships, how do we know whether they're really working?
Yeah, that is a great question, and I'm hoping to do my dissertation around something just like that. But I think it comes in with that whole listening and inquiring up front. So we know in our minds typically the outcomes we want or need, right? In some cases. And but how does that align with the ways in which community members view success? And I really think it's important for us to begin to think about measurement along the way. So there's the process, right? There's outcomes at the end, but there's interim outcomes as well. And there's oftentimes very different views of what success looks like along the way, and at the end, right? So community members are interested in action. They're interested in impacting their neighborhoods, constituencies, organizations, etc. And our interests we may have a particular interest in that, but that's not typically what's driving us, right? And so I believe that it's really important to understand how community members measure success and sort of figure out how those measures can be incorporated along the way. And I can tell you that community members, they have outcomes in mind for the end, but they also see a process a certain way. And we don't lean into really learning about how they would envision a process being undertaken. So I think that really is important.
Thanks, Megan. And thanks, Nikki. Other questions? I have one if no one else any that I also was really intrigued by what you said. I think Nikki, you said it, but really both of you alluded to this, which is, when we're engaging with community partners on research, taking this strengths-based approach and not, part of this not feeling exploited, not feeling taken advantage of is this idea of uncovering the strengths that our community partners have. And I was wondering if you could give some tips for actually how to do that, because I find it's a goal of mine in some of my community partnerships, but I also don't want it to feel, I don't know, like I would be using a person for their strengths. But I was so intrigued by this idea that when you take that approach, it builds sustainability into the project. So do either of you have tips on how to uncover those things if you're not, deeply embedded as a community member and just kind of inherently know the hidden talents of some of your community partners?
Something we do with our community scholars that would be helpful. We do asset mapping, and so while we do this just with them and they take their community and they literally map out, we just use like Google Maps, so it's easy, but we have different categories in terms of, assets, like who are the individuals, where are the organizations, and et cetera. And then they actually map it out using just standard like community asset mapping approaches. We're happy to send you like a worksheet that we use. But I think it would be helpful, to do that at front with the community partner. Yeah, that's what I would say.
Yeah, I agree with that. And I think just starting off thinking in that way reframes it so much. When folks are really reflecting on the good things about a community, it just goes a long way. I'm sure psychologists have a term for this, but there's just something to it when you start off talking about good things that are happening. Recognizing we'll get to need, but we're going to leverage those assets to really address those needs. And it's also embedded within the community. So it's not that you hear the savior sort of approach to community engagement. It's not. I'm going to add to what you guys already do well, to really try to address a particular issue.
Yeah, I think that's great. And also probably gets you further along in the code of conduct and the less relationship counseling, right? Because we're respecting what each other are bringing in strengths and working together for a common goal.
Yeah.
What other questions do folks have or comments?
And I just want to add, one asset you can always start with is the community partner as an expert. Because often oftentimes that gets overlooked. Like, we're trained in our work to be like, we are experts, we are academics, we come in, but really recognizing that and learning in the beginning, not just because they know their community, but like, as Nikki was saying, like, there are other areas of expertise that will benefit the partnership.
Yeah, absolutely.
I have another question, sort of thinking about this concept of building and sustaining these relationships over time. I can imagine engaging with a community without a particular end date in mind, and just sort of, we're going to build a relationship, or we're going to see where it goes. But I could also imagine engaging with a community and saying, here's a time bound. Either it's because of a project and a grant, or there's a specific issue. And I'm curious what your thoughts are about those different ways of approaching a community. Because I could see it being useful to be open and saying, look, I only have 5 years, but it could also be sort of like, make it seem really transactional. So how do you start to think about time?
Yeah. Go ahead, Sara.
Oh, sure. Sorry. Nikki's talking for me a lot because I'm sick. Also, she's better at all this stuff. So she taught me everything I know, right, Nikki? So what I think about is actually what Nikki had said in terms of like the check-ins. Like, they're all of these, they're often time bound, right? You put in a grant, there's a time on it. You have a certain project, you want to do something together. That's just reality. But I think it's like that consistent communication and checking in, whether it's like a text or whatever. And then that's how the next project comes up, which is also time bound. So I think it's like this long-term sustainability. To me, that's what it made me think about. Just like the need for, once the project does end, just staying in touch, like a simple thing like that. But recognizing that these do have time bounds and, funding attached to it or not funding attached to it. And like setting those expectations up front too. Like, I've sort of learned this as I go, and like, you can spend a lot of time on like a grant proposal with a partner, and then like you don't get it. But like, they're not as used to that world of like, oh, you might get like 1 out of every 10 proposals you put in, so it's like, again, like, okay, we didn't get it, I don't disappear. And it's like, just keep in touch. If something comes up, great. And usually it does.
Yeah, I would just add to that, in approaching sort of the work. It's funny, I was thinking about this dropping off kids this morning to school. There's so many people I need to contact, and I'm like, how do you divide this up over the course of your life to stay in touch with everyone, right? And I haven't figured it out yet, but I was just thinking about it this morning. But I do think it's important, and because we're all connected in different ways, I think just getting to know someone before you even have like a grant idea, just building sort of the understanding of where the intersections are, staying in touch every now and then. I try to remember what people are interested in, see it in an article, send it their way. But building that relationship over time, which is what the funders are kind of like saying. So you're not at the last moment saying we need a community partner. We've been talking about this maybe for the last 2 years, and here's an opportunity that I think would be good for us. The idea, I think for me, the thinking is, how can these partnerships not be transactional, as you pointed out, Megan, but more transformational? And to the extent that they can help transform all involved, they are sustained longer. Because remember, it's that feeling. Something different happened in my life, in my community, in my profession because of this experience. And I think that goes a long way.
I've really been appreciating this whole conversation, and I've loved to see the different ways that you've incorporated implementation science into how you're thinking of this. And some of us still on the call, we consider ourselves to be implementation scientists. And for myself, this is what, that's what I think of day in and day out. And so I'd love to hear any things that you want to see more from the field of implementation science, or how we can like best support the work that you're doing. Hopefully, I'm also working on Amethyst, so hopefully we'll get to interact with each other a whole bunch over the next 7 years. But what are things that you want implementation scientists to know? How can we continue to support the work that you're doing?
One thing is, we're putting together our evaluation now. We're a little bit behind in that, just with everything going on. So yeah, it'd be great to come back to like a future meeting, give a idea of what we're thinking, and then get some feedback on that. Would be one way. I'm a DRPH candidate right now in implementation science, so I'm learning alongside of you all.
Yeah, I think more broadly is, I haven't seen anyone take this, map it, but we've seen a process, right? A number of different frameworks for that. But like really look into the implementation piece of it and like really examine it in a different way. Um Test different aspects of it. I haven't seen like someone really do that. Um I think in my mind, because I do it, there's a clear process, right? There's a clear 1, 2, 3, and it never works exactly 1, 2, 3. Sometimes it's 1, 2, 1, 2, 1, 2, and then but that there are certain elements that are important. Um, and it's just in all of the literature pretty much just stated that these are important elements. But what does it look like if it's implemented in a certain way versus another way? Elements are removed, moved around. I think those kinds of that level of thinking for community engagement is important because there isn't one right way. Also, contextually, what may work in one place does not work in another. So really honing in on where we are, and the work that we do also is another way of maybe thinking about it differently. What tends to work, in certain contexts versus others.
Yeah, like originally we had thought about like testing strategies against each other when we launch Reach, and we just like don't have the resources. So like we could put together a grant, so maybe like helping us do that, or if someone else is interested in that and working with us, that would be amazing.
Yeah, a thing I think about sometimes along these lines, Laura Ellen, is like, how do we as implementation scientists think about partnered approaches like CVPR? And are they a strategy? Are they a framework? Are they a non-negotiable? And so many things we think about, like co-creation that you all have mentioned. I wrote down all the words that like co-creation, sustainability, partnerships, trust, all these things that are like strategies that help enhance effectiveness and sustainability of things. Like they're baked into a good partnered approach with a community partner, whoever you define community as. And I think it's kind of interesting. I'm not sure, the literature is kind of wishy-washy about, well, what does that mean in implementation science? Is it a strategy, or is it an approach, or is it both? When do you use them? Outside of a funder making you partner with a community, what is the rationale for doing it that actually drives the effectiveness of your project and the impact, rather than just a thing you have to do because somebody's making you? That's kind of interesting to me.
Yeah, like I feel like, community engagement is just so baked into implementation science. It's just a part of it, but maybe there could be a way or another, like we need another framework, but to like make it more explicit, like the merging of community-based participatory research and implementation science, and sort of that would be kind of cool to think through.
Yeah.
I think we have a long way to go, Sarah. It's baked in a lot of ways, and we talk about stakeholder engagement, and communities are stakeholders, but there are other stakeholders as well. So I'm not convinced that we do it well all the time. And I also think that communities are sometimes engaged as a sort of checkbox, like, hey, can you look at this and tell me you like it?
Yeah.
As opposed to bring in a community or partner with a community at the very beginning maybe even before you have a research question, so that your research question actually reflects what community members are interested in. Like there's a long way to go.
Yeah, no, I totally agree. I think like the field might think it's baked in, like, you know, of course.
It's like how we all think we're doing a great job with our partners and they don't think that we are. So I think there's probably work that could be done on really explaining that a little better and showing some evidence around the why for doing it at the beginning versus kind of tokenizing community partnerships, which none of us want to do.
Yeah, like even like a scoping review on like implementation projects and how they've engaged community, you know, something like that.
Yeah, that could be really fun, I think.
Yeah, one of the things Megan and I have talked a bit about is one of the big things in implementation science, right, is like having an evidence-based practice, right, or an evidence-based intervention. Well, how do we consider something evidence-based? And recognizing that there's a whole bunch of issues baked into the evidence-based practices or interventions. And I think this goes back to the earlier conversation, thinking about taking a strengths-based approach to communities, recognizing that communities are experts in their own lived experiences. And one of the things that I've been wrestling around or mulling around in my own mind is having this intellectual humility that, right, like I do have like a certain degree of expertise in this like one very, very, very narrow, like very, very specific thing. And community partners have so much more expertise on, you know, in other areas. And so having that intellectual humility while also recognizing that what academia deems evidence-based is not the totality of an evidence-based like practice as we think about it holistically. So yeah.
Laura Ellen, I was just having that
Okay.
conversation with someone. Like it's so yeah, I agree 100%. We could say more, but
Yeah, I love that perspective. Just being able to reflect in that manner and to just understand the context in which we all work. These sort of frameworks and what is considered evidence-based versus not, they come from one position, right? One view that historically was set up not to be inclusive of diverse views, right? And so I really think having that kind of reflection along the way can go so far, like in the field. It can just propel us because that doesn't happen. We just accepted that we're part of this system and this is how it goes, right? But what is evidence? And that's a great question. And how can we help define, reshape the thinking around what is evidence-based?
Yeah, and for us, what's implementable, you know, if that is driven by community voices, it has a whole different meaning than just classic evidence that should be translated in different places. Thanks, Megan, for your comment in the chat. I know NHLBI is looking for strategic direction. It would be interesting to talk about community academic partnerships. We have these experts who are like doing it so well here. So it might be a really interesting thing to pursue going forward.
If nobody else has anything, I just want to say hi to Miss Deborah. As a community partner, I'm just wondering, like, how are you like taking all this in?
Good morning, everyone. It is a pleasure to be with you today. I am super excited about everything that I've been hearing as a community-based partner and as a survivor of multiple chronic health issues. I, of course, understand and recognize the importance and significance of working to reduce the disparities that we all, you know, are seeing on a daily. I'm excited to be a part of this. I pray that it's an opportunity for me to take some of the things that I consider experience to gain with you who have an expertise, and that we're combining these efforts so that we can make the changes that are necessary. So I'm excited to be here.
I'm excited you're here. Nice to meet you.
It's great to meet you as well.
Yeah, wonderful to meet you. Thanks for being here.
Thank you.
Well, if there aren't other questions, we can end a bit early. I know Sarah's a little under the weather, so maybe we can take her off the hook for speaking. But I do want to thank you, Nikki and Sara, again, so much for sharing your work and inspiring us all to make our community academic partnerships authentic and impactful. You both are really good examples of that, and appreciate everyone's attendance and engagement today.
Thanks for having us.
Yeah, thanks for having us.
Thanks so
Thank
much.
you so much.
Enjoy
Bye-bye.
your day. Bye-bye.
Bye, everybody.